Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the neuroanatomy of the vagus nerve. The vagus nerve is a mixed nerve. It has motor, sensory, and parasympathetic nuclei. The motor nucleus is located in the medulla oblongata. This is the lower part of the brain stem and is formed by the nucleus of ambiguous. Nucleus of ambiguous also contribute in the ninth cranial nerve and also 11th cranial nerve. So nucleus ambiguous has contribution to three cranial nerve, the glossopharyngeal nerve, vagus nerve, and the cranial part of the accessory nerve. The motor fibers supply the pharyngeal constrictor and the intrinsic muscles of the larynx. Okay, so if we go to the parasympathetic nucleus, this is the parasympathetic nucleus, this is the motor nucleus, and this is the nucleus for the tractus solitarius for the taste sensation. Okay, the parasympathetic nucleus is located in the floor of the fourth ventricle. This gap is the fourth ventricle, and this is the location of the parasympathetic nucleus. We know that nucleus is the collection of nerve cells in the central nervous system. Okay, we got that. And this parasympathetic nucleus receives afferent fibers from the hypothalamus and from glossopharyngeal nerve. Okay, that is the carotid sinus reflex for maintenance of blood pressure. Okay, and as a baroreceptor. So afferent fiber from the hypothalamus. So this is descending autonomic pathway. We know that autonomic nervous system is controlled by the hypothalamus. Efferent fibers innervates the involuntary muscles of the bronchi. Bronchi has smooth muscle, heart has cardiac muscle, there is also involuntary muscle. Esophagus has smooth muscle, especially lower one third, and mixed with skeletal muscle in the middle third of the esophagus. Small intestinal wall has smooth muscle, and the cecum, ascending colon, transverse colon up to the proximal two-thirds of the transverse colon. The parasympathetic innervation is carried by the vagus nerve. Okay. If you go to the sensory nucleus of the vagus nerve, sensory nucleus, it is the lower part of the nucleus of tractus solitarius. Okay, we have gone through that part, associated with taste sensation from the extreme posterior part of the tongue and from the epiglottis through the inferior ganglion of vagus nerve. Efferent fibers cross the midline and synapse with the ventral nucleus of the thalamus. Thalamus is the great sensory relay station. All sensation except the olfaction should go through thalamus with the relay. From the thalamus, fibers are projected to the lower end of the post-central gyrus of the cerebral cortex. Okay, if you go to the previous image, we'll find out this. Okay, this is the nucleus of tractus solitarius. So we are getting fiber going to the other side, going through the thalamus. There will be relay here, and there will be, by means of the internal capsule, you will go to the cerebral cortex. This is the cerebral cortex, and in the post-central gyrus, we have the taste area. Okay, the lower part of the post-central gyrus near the lateral sulcus. Okay, we got the sensory innervation. Okay, if we go there, and our vagus nerve has a very long course. It innervates the meninges of the brain, external ear. Okay, it innervates the pharynx, larynx. Okay, it innervates the bronchi. It innervates the lung, innervates the heart, and in the esophagus it forms esophageal plexus and gets some contribution from sympathetic fiber from the thoracic sympathetic chain of ganglion, but it is mostly parasympathetic, with partly contributed by the sympathetic. From the esophageal plexus we'll get the anterior vagal trunks and posterior vagal trunk that enters the abdomen through the esophageal opening of the diaphragm at the vertebral level T10. Okay, so this vagal trunk will contribute the innervation of the parasympathetic innervation of the stomach, duodenum, jejunum, ileum, cecum, vermiform appendix, ascending colon, and up to the transverse colon. Okay, so there are many branches, sensory branches of the vagus nerve. It is the lower part of the nucleus of Tractus solitarius. We have discussed Tractus solitarius. Tractus of solitarius also get contribution from the facial nerve and also from the glossopharyngeal nerve. Associated with taste sensation passing through the inferior ganglion of the vagus nerve, efferent fiber crosses the midline, synapse with the ventral nucleus of the thalamus. From the thalamus, fibers are projected to the postcentral gyrus. Okay, lower part of the postcentral gyrus of the cerebral cortex. Okay, now we got the image here. If we look at that, we have the superior ganglion that is associated with that of the axonal auditory meatus. Dura mater, the meninges of the posterior cranial fossa, is also getting innervation by the vagus nerve. It is involving the superior ganglion of the vagus nerve. Vagus nerve has two ganglion, superior ganglion and inferior ganglion. One is called jugular ganglion, another is called the nodose ganglion. The inferior ganglion is associated with taste sensation of the epiglottis, root of the tongue, and palate. Okay, and we are also getting the muscle innervated by the vagus nerve, like the pharyngeal constrictor, intrinsic laryngeal muscle. The vocalis in the intrinsic vocal is also an intrinsic laryngeal muscle. The cricothyroid muscle. Most of the palate, except the tensor veli palatini, which is innervated by the mandibular nerve. Upper esophagus, okay, also get innervation from the vagus nerve here, okay, by means of the pharyngeal plexus, okay, but the smooth muscle is also getting innervation by means of the inferior ganglion. Okay, we'll go through the inferior by means of the intramural ganglion, the ganglion present in the wall of the viscera. Okay, that is the intramural ganglion. This is the parasympathetic ganglion here, and parasympathetic fiber is going to innervate the smooth muscles and glandular epithelium of the gut. Gut means from the esophagus to the right 2/3 of the transverse colon, and also it will provide innervation to the cardiac muscle. Okay, general visceral afferent fiber input from the pharynx, base of the tongue, thoracic organ, esophagus, intestine to the splenic flexor is also carried by the vagus nerve. Okay, and these are all the structure are getting innervated by the vagus nerve. So we'll go to the clinical notes. Examination of vagus nerve, gag reflex. If we tell the patient to open the mouth and cooperate, and if you touch the posterior 1/3 of the tongue by a tongue depressor, there will be gag reflex. Okay, so the efferent component is carried by the ninth cranial nerve, glossopharyngeal nerve. Efferent component, that is contraction of the pharyngeal muscle, is mostly done by the vagus nerve, partly by the glossopharyngeal nerve. Okay, because glossopharyngeal nerve also innervates the stylopharyngeus muscle. So we can, by gag reflex, we can assess the functions of the ninth nerve and 10th nerve. Movement of the soft palate. If you ask the patient to say ah, look at the soft palate and uvula, it should move up and symmetrically, so it indicates the vagus nerve is intact. Movement of vocal cord is very important, especially during be goiter surgery, there may be recurrent laryngeal nerve injury, or any cancer in the thyroid may involve the recurrent laryngeal nerve, or maybe even the external laryngeal nerve. Then there will be hoarseness of voice. Dysphagia, difficulty in swallowing, that may happen when the esophageal muscle cannot coordinate properly, cannot contract or relax properly. Vagus nerve section may lead to tachycardia due to sympathetic overactivity. Okay. If the vagus nerve is stimulated, then we'll get bradycardia. If the vagus nerve is cut, then we'll get tachycardia due to sympathetic overactivity. Okay, these are my references here, and that's all about the neuroanatomy of the vagus nerve. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me, and have a nice day. Bye now.